Hi everyone. I picked the topic of toxoplasmosis because I've had cats my entire life, including when I was pregnant with my kids. This information I found in the book and on a website called Healthline. Our book says that according to the March of Dimes, the tiny parasite Toxoplasma gondii or T. gondii affects more than 60 million people in the US. Routine prenatal screening does not test for this parasite. Toxoplasmosis can cause premature birth, stillbirth, and can cause birth defects to the brain and eyes. This parasite can be found in cat feces, undercooked meat, contaminated food, and water. Some of the symptoms are often flu-like and may include fever, muscle aches and pains, sore throat, headaches, swollen lymph nodes, especially in the neck. Toxoplasmosis is especially serious for people who have severely weakened immune systems. It can lead complications involving the eyes, brain, lungs, and other organs. Pregnant people with toxoplasmosis can also pass it on to the fetus. This is called congenital toxoplasmosis. It can cause miscarriage and stillbirth. Congenital refers to conditions acquired in the womb or that exit in the child from birth. Children born with congenital toxoplasmosis can also develop other health problems later in life. About 75% of newborns born with toxoplasmosis don't have any noticeable symptoms at birth. In some cases, congenital toxoplasmosis can be detected alongside irregularities in the baby's brain and eyes. Signs and symptoms of these rare cases include poor feeding, skin rash, swollen lymph nodes, jaundice, enlarged liver or spleen, anemia, low platelet count, crossed eyes, and seizures. Other symptoms can be hydrocephalus, low birth weight, micro and macrocephaly. Most people become affected when they ingest the parasite. This can happen in several different ways. Cat feces, the parasite can be in nearly all warm-blooded animals. Cats are the only known host. A cat with toxoplasmosis can shed millions of eggs in its feces for 1 to 3 weeks after infection. It's possible to contact T. gondii when you're exposed to contaminated cat feces. This could happen if you clean out a cat litter box without washing your hands afterwards. If you're pregnant, you should ask someone else to clean out the cat box. If you absolutely must clean out the cat box yourself, use gloves and empty the waste from the box daily. The parasite isn't infectious until 1 to 5 days after it sheds. Overall, it's very rare for humans to get toxoplasmosis from cats. House cats that aren't allowed outside have a very low chance of carrying the parasite. Wild cats or cats that live outside and hunt are more likely to be a host of the parasite. Cats don't usually show symptoms of toxoplasmosis. Another way to get the parasite is from undercooked meat. This includes pork, lamb, venison, shellfish like oysters, mussels, or clams. Make sure all meat and shellfish are cooked to a safe internal temperature before eating. Hand washing is very important. You can get toxoplasmosis by handling raw or undercooked meats or shellfish and then touching your mouth without washing your hands. Toxoplasmosis is diagnosed from a blood test. A doctor will typically perform a blood test to check for antibodies to T. gondii. If you've ever been exposed to T. gondii, antibodies to the parasite will be present in your blood. If your antibodies test is positive, then you've had toxoplasmosis at some point in your life. A positive test result doesn't necessarily mean that you currently have an active infection. If your test comes back positive for antibodies, your doctor might do further testing. In general, babies who get toxoplasmosis early in pregnancy have more severe health issues than those who get it later in pregnancy. So if you're pregnant or planning on becoming pregnant, avoid litter boxes and undercooked meats and wash your hands, which is always a good idea anyways.